Today I'm telling us a story about a man that stepped on a clean nail on the ground, to him in quote, a clean nail on the ground. So when people told him to go for hospital or take anti-tetanus vaccine, he said no, because from his own experience, tetanus can only contact tetanus when you step on a rusty nail. So he disregarded it and then went about his usual activities. Now the wound got healed, so he did not really pay much attention to it. Wound got healed, there was no infection on the wound. So he felt, okay, I told you guys this nail is actually a clean nail, so I cannot get tetanus. Then, like a month after, the part of the body was just moving without him moving it himself. So he was bothered about it, but then he linked it to spiritual attack. So rub an on a part of the body, then discovered that other part also got involved in this involuntary movement. So rub himself an oil, prayed about it and everything like that. But then this thing did not stop. Still, he kept having this involuntary jerking. To the extent it affected his work. He could not. He's a driver, so he could no longer drive anymore. If he's driving, he would have that jerk, and then so he stopped going to work, and then focused primarily on praying for the spiritual attack in quote. Then he got to a stage where he could no longer stand again, so they had to rush him to the hospital. Initially, when they brought him to the hospital, asking questions and everything, but from the clinical symptoms anyway, you already have this mindset that this can be a tetanus infection. Then we asked question and everything. Then they told us how he stepped on the clean nail in quote. He didn't take any antibiotics. He did not go to the hospital. He did not take tetanus vaccine. And then the wound healed on its own, thank God. But now he's not having the symptoms. Now, even trying to tell the relative that this is what actually caused the problem from that wound that is already healed, that is where the tetanus infection got into the body. They were still doubting because if a wound is infected, it will not heal. The only thing there now is scar. Then how come the man is having tetanus infection? After much explanation. Now, tetanus infection is a bacteria that stays on the surface, either rusty nail or clean nail, even needle, sewing needle and you see, tetanus can be on it. Now, if it pierces your body, it can stay for some time, depending on which part of the body or on how far the part of the body is from the nervous system. Now, if it's far away, it will take a longer time for the effect to be felt. But if it is close by, let's say for instance, happened to on your shoulder, it's the effect of tetanus infection actually starts on time. But for him, it was on his foot. He stepped on it, so it took a longer time for the toxins to get into the system and start causing that spasm. Well, we tried our possible best. When the symptoms actually start, it's hard for a person to come out of it because it releases a toxin into the system. So even if you give antibiotics that kills the bacteria, the toxin is still in the system. The toxin has to outlive its own days before it will just die off naturally. That is when the patient have control of their body back. Now, what normally kills tetanus patients is due to tiredness because their body keep jerking, so they get tired with time, and then they die. There are some images that I will show you. If you see it, you think it's because of spiritual attack, because of the way the person will be tense and then bent. You think it's a spiritual attack, but that is tetanus attack or tetanus infection in full play. What I'm trying to say is, if you got pierced by any sharp object, whether it is neat or dirty, please make sure you press your hand, let blood come outside, then put it under running water. Then after that, go to the hospital and give you, if you've not taken tetanus before, vaccine before, to be given to you, then you'll be given some antibiotics to prevent all this from happening. Now, my main point is tetanus can actually stay on both clean and dirty objects, even the one you use at home and the one you don't use at home. And as for the patient, we actually lost the patient after 2 days. Now, all this could have been prevented if he just listened and then go to take his vaccine and the antibiotics at the right time. So please stay safe. If you've not taken your tetanus vaccine, look for the nearest place where you know can be given and then take it. Thank you very much.